Hey, Dr. Shannon,
Hey, Dr. Mora.
how are you?
I'm well. How are you doing today?
Doing great. Doing great. Well, thanks for chatting with me today. We're excited to talk about this ovarian reserve and ovarian reserve testing. It's something that you and I could talk about forever, but let's launch in. So, two markers of this, right? That we typically have patients coming in with. So talk to me about the first one, AMH. What is it? What is that exactly?
Yes, so AMH is one of the three things typically tested when assessing ovarian reserve. AMH stands for anti-Müllerian hormone, and it's actually a hormone that is secreted by immature follicles, which you can think of as eggs within the ovary. So the more eggs that are there, the higher that hormone will be in theory. So it's one way of providers kind of assessing the egg supply in the ovary.
The egg supply, right. And so this number is not a static number per se, right? It can move around.
It definitely can. A lot of people, it's maybe a misconception that it is a stagnant number.
Mm.
However, by improving ovarian health, we do see this number tend to increase.
Increase, right? And talk to me about, AMH and its connection with pregnancy outcomes, right? Because I feel like there's a misconception there as well, a little bit.
Yeah, definitely. So I think what's important to know is that ovarian reserve testing in general was developed for, couples going through infertility and
Mhm.
seeking things like IUI, IVF. And so AMH, the importance of AMH and what we know about AMH is giving those reproductive endocrinologists, fertility doctors insight into like how well the ovary is going to respond to their
Right.
interventions. Um, However, in the grand scheme of things, AMH is not actually tied to or correlated with pregnancy rate or the success of pregnancy. So, like pregnancies resulting in a live birth.
Right.
So you can have a very low AMH and still conceive.
Yeah, which I think is very worth underlining, right? And so, but it is a good correlate for us to kind of measure as time goes on, and to measure impact of our therapies, which can improve
Right.
AMH. So that's the
Absolutely.
good news.
And just to add to that, I think, like we certainly still measure and test and appreciate AMH. We use it kind of like you said,
Yes.
a marker to track
Hmm.
progress. Also, just for women looking to map out or plan their reproductive longevity,
Right.
AMH can be helpful. It's a value that in theory, your egg reserves are
Yes.
declining with age. So knowing your AMH throughout your fertile years can be helpful when it comes to family planning.
Absolutely. Yeah. So an important number, not the only number though. So
Correct. Not the only number.
yes. So to that point, FSH. So tell me about FSH, right? This is another marker we talk about. One of the other
Yes.
markers. Hmm.
So FSH, it stands for follicle stimulating hormone. It's the brain's signal to the ovary that it's time to produce a follicle to ovulate at time of ovulation. It's correlated to AMH or to ovarian reserve in general, in that the more, in theory, the more eggs or follicles present within the ovary, the less FSH that's required. A really common analogy is used that if there's a lot of eggs in the ovary and they're really healthy, the brain only needs to whisper, "Hey, it's time to
Hmm.
get a follicle ready." If there's a declining supply or supply that's not very healthy, the brain is going to send more and more FSH
Right. Sort of
to
shouting at that high level. Yeah.
Yes. Yes,
Yeah.
exactly. And it functions really reliably in a feedback loop with the
Mhm.
ovary. Gives us insight to some of the other hormones. And kind of along those lines with the AMH, like the AMH is an important marker, but in isolation, it doesn't mean much. And the FSH is the same way. You need a number of other hormone markers when you run the FSH to really have a comprehensive understanding of what's going
Understand.
on, and
Right.
also to validate the level of FSH that you're
Right.
you're getting.
Right, right. So you can have a low AMH, but if your FSH is also low, you're good, right?
Right.
And vice versa. So you have to think of them together ultimately. Um,
Yes.
to give us a proper understanding. But again, FSH can be high, but
Mhm.
there's much we can do to shift that as well, right? So
Yeah.
it's not a static number.
Again, yeah, it's not a static number. FSH is right. Women are on this monthly cycle where things are fluctuating all month long, and then a new cycle
Yeah,
starts. It starts all over again. So FSH, in theory, you can measure cycle after cycle and could possibly get different values for. AMH is a little bit more static, like you can measure it at any time in the
right.
cycle, but it is, movable, adjustable. But yeah, FSH, you have an opportunity pretty much with every cycle to change or improve that value.
Yeah. So it's knowing these numbers, right? Super helpful, but much we can do to help people naturopathically ultimately. And it's very individualized, right? I mean, this is where the
Right.
personalization of what we do in our practice is so helpful, right? Because what works for one person is not going to work for the other person. The one person's reason for low AMH or very high FSH are going to be very different from the next. And so we have all of these therapeutics we use and functional testing. It's kind of exciting, right? Because I feel like it gives people tools and things they can do to affect some change, right? So
Right, absolutely. And I think that's a great thing to point out. Two people can come to us with elevated FSH, but we may approach them and treat them completely differently
yeah,
based on, what we uncover is the reason for that elevated FSH ultimately.
yeah, exactly. So it's exciting. There is hope, right? With these numbers. So
Definitely.
thank you so much. This is super interesting.
Yes, it was great chatting with you.
You too.